Some patients have significant essential tremor that affects their daily activities and tasks, and they're willing to take the risk, the small risk, but the risk of brain surgery, or there's deep brain stimulation, or it's a focused ultrasound risk, when some don't want to take those risks and want to wear something that's not invasive. So I think it has more to do with risk evaluation and acceptance of risk than it does with efficacy, because all these patients have a degree of tremor that's going to get worse over time. So you have to do something at some point, or have tremor that interferes with those tasks. So I think it more as a risk rather than the tremor that's always present. We have deep brain stimulation that's very effective when done unilaterally. It's often very safe in putting it into the thalamus, but when done bilaterally, patients may have trouble with speech or swallowing, and it's still brain surgery, so it requires a hole into the skull and wire into the brain, so there are risks that, although low, are still present of hemorrhage and stuff like this. We have focused ultrasound that's been more recently available, where ultrasound rays can be focused and the parts of the brain and the thalamus can be heated up until we see a tremor improvement, and then heated up more to cause destruction of those cells, making a hole in the brain in essence. And if the tremor comes back, it can be repeated. This is non-invasive in that it doesn't require a hole in the skull and wires in the brain, but it's still destructive to the brain, making a hole in the brain, so it can still have side effects that go along with that. More recently, we've had some work on neuromodulatory devices like a bracelet that one can wear, and this gives stimulation, sort of like a TENS unit, to the median and radial nerves. And this goes on for about 40 minutes, and then for the next hour or two or three, there's maybe less tremor amplitude, allowing patients to complete certain tasks. And this device will become commercially available.